Welcome to Biopractice webinar on Reconcile ICH GCP with evidence-based monitoring and study management approaches. The presenter for today's webinar is Beat Weidler, PhD, Diploma Pharma Med Managing Partner for Weidler and Schumann Limited, Switzerland. During the presentation, for any kind of questions, kindly post your questions in the chat box of your GoToMeeting tool, and the speaker would address those questions during the Q&A session. And now, I would like to hand over to the speaker, Beat Weidler. Over to you, sir.
Thank you very much for the kind introduction. Welcome to this webinar. Good morning, good afternoon, whatever part of the world you are sitting in front of your computer today. What I'm going to share with you is, in the first part, a short review of those sections, paragraphs of the ICH, GCP that have an impact or are impacted by an approach that utilizes evidence-based methods to exercise study management, and then review with you a couple of approaches that have already been implemented to make this happen. I took the liberty of revising the title of the webinar, and I did this not because I like to correct other people, but because I would like to emphasize 2 points. First of all, the term risk-based monitoring in a way is misleading and could even raise concerns with patients, ethics committees, and other parties, because it could imply that rather than doing monitoring, we are taking risks. So I think the more appropriate term should be evidence-based, because what risk-based monitoring really does is to utilize objective data to drive, steer, and also fuel the way we are keeping control of our clinical trials or clinical studies. And that's the second correction. I think that monitoring is too limiting in its concept. Monitoring seems to say that we just apply this methodology once we have finalized the protocol, we have rolled out the protocol, we have set up our CRF, we have established the monitoring policy, and then we just tweak it to make it different, more efficient. I mean, that's the dream what we all have. And I think we need to have a more holistic approach, and that's why I prefer to use the term study management. Because what we need to address is really the whole life cycle of a clinical trial, from its planning, from its testing of the plan, its rollout, implementation, conduct, and closure. So I have started to not to utilize any longer the term risk-based monitoring, but to move it and to utilize the term evidence-based study management to reflect this more holistic approach. Let's then move to the to revising a couple of ICH paragraphs that are relevant in our in this context. Paragraph 138 very clearly states that monitoring, the act of overseeing the progress of a clinical trial and of ensuring that it is conducted, recorded, and reported in accordance with the protocol, standard operating procedures, GCP, and applicable requirements, it very clearly says that if we take that to the essence, it's basically ensuring that we do what we have planned to do, we stay in control, and we are able to demonstrate that we were staying in control. Quite rightly so, and I think that I really need to commend the authors of ICH GCP, a document that was written more than 20 years ago, when electronic data capture was a dream, or what not even thought of, at least not as a routine, when the internet wasn't used, social media were far away, and even email was just at its inception. So already at those times, they kept it very broad so that any methodology we use to monitor is in compliance with the spirit, but also with the letter of ICH GCP. What is good news? Another paragraph, 5.11, about quality assurance.